What makes a high-quality guideline? Sponsored by the Canadian Partnership Against Cancer. High-quality cancer practice guidelines are systematically developed statements that assist healthcare practitioners, patients, and policymakers make informed decisions about appropriate cancer control options. For example, a psychiatrist who has a patient with anxiety because of a recent prostate cancer diagnosis would likely want to read a practice guideline called Distress Management for Men Diagnosed with Prostate Cancer to help make decisions about how to treat that patient. In order for practitioners and patients to trust the recommendations in a practice guideline, a high-quality guideline should be well-developed, well-reported, well-written, and based on the best available evidence. So, what are some of the things that make a high-quality cancer guideline? Well, quite a few things. First, we need to assemble a group of content experts that are representative of all the relevant disciplines needed to write a guideline on a particular topic. Clinical experts include different health professionals, for example, surgeons, doctors, nurses, or physiotherapists. Many groups include health research experts to give advice about guideline development methods, and patients to make sure that their opinions and preferences are also taken into consideration. People who shouldn't be involved are those who might have inappropriate conflicts of interest. For example, a stockholder in a company that sells the product that the guideline is recommending. Next, we need to choose a guideline topic that is relevant and useful. There is no need to develop a guideline about a healthcare option that is not likely to become available in clinical practice, or on topics with outdated procedures or treatments that are no longer used in practice. Once a topic is selected, it's a good idea to develop a project plan to outline the scope of the guideline and define who will do what and when. The project plan describes the steps and methods that will be used to complete the guideline. A high-quality guideline will fully describe the specific questions that the guideline is attempting to answer. The questions should be complete, specific, and answerable. This is true whether the scope of the guideline is broad, for example, management of all patients with breast cancer, or narrow, for example, Herceptin as adjuvant therapy for women with HER2-positive breast cancer. A high-quality guideline uses a systematic process to find and select the evidence to use to answer the clinical questions. Picking and choosing only the evidence that supports the opinion of the development group without doing a systematic search for evidence represents a biased approach that may be misleading, and therefore will not be reflective of the entire body of evidence. Once the appropriate evidence has been identified, a high-quality guideline should assess the quality of that evidence to determine how valid it is and if the results can be trusted. Then the group can decide how much influence it will have on answering the question and creating the recommendations. Guideline recommendations need to be concise, understandable, implementable, and easy to find. Unclear recommendations are not helpful to people who want to use the guideline. For each recommendation, it is important to show a clear link to the evidence supporting it. Guidelines should clearly report whether each recommendation is based on evidence, expert consensus, values and preferences, resources or cost, or a combination of these. Before guidelines are published, they should be reviewed by other experts who are not part of the guideline development panel. Feedback from these expert reviewers helps to ensure that the guideline was developed properly and helps to increase the acceptability of the guideline because they were able to have some input into the guideline. Finally, a guideline should have ideas in place for dissemination to target users, implementation in clinical practice, and updating of the guidelines when new evidence or system changes bring about the need for changes to the recommendations. A high-quality guideline is well organized, well written, well reported, and the recommendations are easy to find. If clinical decisions are to be made based on the recommendations of practice guidelines, then it is important that guideline developers take the time to produce high-quality guidance that is trustworthy and useful. This has been a presentation by the Capacity Enhancement Program, sponsored by the Canadian Partnership Against Cancer.